Hi everyone, welcome to Rethink, Your Life, Your Choice. We're bringing community residents like you and partners together to work on important health-related issues in our community. I'm your host, Emily Deeringer. Thanks for being here today. I'm one of the coalition coordinators for Rethink, Winnebago's Healthy Living Partnership. But some of you might not know that I'm also a staff member with the Winnebago County Health Department. We're trying to do our best effort to make sure our residents know that Rethink is connected to the health department, and the work that Rethink is doing is also related to public health. It's public health in our community. So we're going to be doing a little bit more, not only this episode, but in the future, trying to connect those dots a little bit better. So when we're talking about Rethink, we're also talking about public health. So stay tuned for some exciting changes coming up the next couple years. So joining me today is Julia Garvey. She works as a healthcare navigator at Partnership Community Health Education Center in Appleton. She's here to discuss the Affordable Care Act and open enrollment. So thank you very much, Julia, for being here today. So can you tell us a little bit about Partnership Community Health Education Center and your role there?
You bet. Partnership is a community health center that provides medical, behavior, and dental care to anyone in need. We primarily serve the Tri-County area, but we won't turn anyone away. We do accept all forms of insurance, including Marketplace and Badger Care. And we have a brand new, beautiful dental center here in Oshkosh. And your cameraman has a gorgeous smile, courtesy of Partnership.
Way to go. So can you tell me a little bit about your role as a navigator with Partnership? You bet.
Navigators provide free in-person assistance to get through the health insurance marketplace or enroll in Medicaid, which we call Badger Care in the state of Wisconsin.
Gotcha. And it's perfect timing to be talking about that right now.
It's open enrollment. And so here's the little elephant in the room, that post-election, I want everybody to know that you can still get enrolled in health coverage for 2017, so you can continue getting care and have a healthy 2017.
That's probably something a lot of people have on their minds.
There's some questions, yeah.
Awesome, great. So let's talk a little bit more about that. So can you tell us a little bit about what is open enrollment and the timing and all that kind of stuff?
Open enrollment is the period of time that you can get enrolled on the health insurance marketplace, which is what some people call Obamacare. It began November 1st, but we've got an important deadline coming up on December 15th. That's the last day to get enrolled to have coverage that starts on January 1st.
And if you don't make it by that December 15th date, maybe you're watching this in the Christmas holiday time or whatever, is there a chance for people to sign up after that?
So a lot of people already have coverage through the marketplace, and it's really important to go back and update and renew for 2017. It helps to reset your tax credit or your affordability on the marketplace. If you miss the December 15th deadline, you can get enrolled all the way up to January 31st.
Okay, great. Just in case there's some stragglers.
Don't delay.
Don't delay. All right. So if someone doesn't have health insurance coverage, or maybe they aren't sure if their current coverage is the right fit for them, kind of what happens when they come meet with you? Are you the only navigator at Partnership?
At our Partnership Education and Enrollment site, we've got other certified application counselors. We can provide assistance in Hmong, Spanish, and English. And what we do is we'll sit down, we'll learn more about your family, your household, who's in your tax filing household, help you calculate your income for 2017, and then help fill out an application on the marketplace and help you choose a plan that fits your provider network.
So if someone would go into Partnership, then do they have to make an appointment, or do they just walk in, or how does that work?
Walk in if you've got a little time to spare, but making an appointment would be best, or it's a really busy time of year right now.
Awesome. So if someone has need of your services, there's some special events that are going on right now.
Because we are so busy and not everybody has daytime hours to come Monday through Friday, we have a Super Saturday event coming up on December 10th. If you've got our flyer up, you'll see we borrowed a little coloring from our favorite sports team.
We can't say the name, but you know who it is.
No, little green and gold to encourage you to come in, avoid the penalty, meet the challenge of filling out your application, and set your health goals for 2017.
That's awesome. So we want to make sure people are rethinking their decision to go uninsured in 2017, and the Super Saturday events definitely can help with that.
9 to 2 at Menasha, Goodwill, or here at our Oshkosh Dental Center.
Is a Super Saturday in January as well?
January 14th, and don't let things go too long. Don't avoid getting coverage because you think things might be different this year. Get your coverage and get your care.
Awesome, great. So I know we have a little bit of of time yet, so is there anything else you want our listeners, our viewers to know about open enrollment or healthcare in general?
Well, it's interesting. There's a missing group of people who aren't getting insured in the state of Wisconsin. Of the 40% remaining uninsured, they're the ages of 18 to 34 who aren't getting coverage. So these are young people who maybe haven't had physicals or well checks since their high school sports exam. You don't want to have an accident or something catastrophic happen that propels you into debt. So we really want to encourage young people to get coverage and have access to regular primary care.
And as public health would say, prevention is so important.
Exactly.
So having healthcare coverage also includes all of those preventative type visits as well.
Exactly. You'd have access to your well checks, your women's visits, medications that you might need, counseling for mental health, the whole gamut of care.
Awesome. So thank you so much for being
Thanks
here
for
today,
having me.
Julia. You have been a wealth of knowledge on this topic.
Get enrolled, everybody.
And we're really hoping that people will take your advice and check out Partnership if they need help. Otherwise, healthcare.gov or coveringwi.org are both great places to go, and we had some of those graphics up on the screen.
Or you can call the United Way operators at 211 to find local help in your community.
Great. So if you forgot all of those numbers, just call 211.
211.
211. Awesome. All right. Well, thank you again so much
Thanks
for being
for
here
having me.
today. That's pretty much all we've got time for today for our show. You can always connect with Rethink about what's going on and on our health department through our websites. The health department website is winnebagopublichealth.org, and the Rethink site is rethinkwinnebago.org. You can also connect to any of our social media platforms through either of those websites, or you can just search for us, Winnebago Public Health, or Rethink Winnebago. So we hope that you stay connected with us throughout the year, and we're really glad to have you be a part of our community and helping make the healthier choice the easier choice. Until next time, have a great day.